The Health Tax Alliance wants you to pay more tax. Would you like to pay more tax? What if it was beneficial to your health to pay more tax? The Health Tax Alliance, which I will call the HTA from here on, is a new organization in South Africa that's calling for higher taxes on things like sugary drinks, alcohol, and tobacco. They believe these taxes could really help the public health system, and they've got people talking, and most are kicking against the idea of paying more taxes. Would you? Welcome to the Rianru Show, where I explore some stories that affect every South African in some way or other. Let's get to the story. The HTA is a coalition of public health advocates, researchers, and activists who are pushing for higher taxes on products like sugary drinks and alcohol and tobacco. The HTA was recently created after a symposium on the 17th of October 2024, and one of their directors is also the executive director of the Rural Health Advocacy Project, Russell Rensburg. Yes, just Rensburg, not Van Rensburg. And they seem to have been the main driving force behind the creation of the HTA. But what is their main argument? Russell Rensburg, in a short interview on ENCA, said that, as an example, tobacco and other related diseases cost the health system upwards of 48 billion rand annually, and that tobacco sales only raises about 40 billion rand in taxes. They are hoping to build a fair argument to say that these taxes should not only be increased by the amount of inflation, but that they should be adjusted for the public health impact they are causing. In other words, they want to punish those who smoke even more for smoking, so as to cover the cost of caring for them when they suffer a health issue related to smoking. They are also hoping that these higher taxes will reduce the number of smokers and also reduce the number of people consuming alcohol and reduce the sugar content of sugar-sweetened beverages. Prepare to drink more water and bitter cups of coffee or tea, or pay more tax if the HTA have their way. It seems the HTA has a plan to tax South Africa into a healthy society. Russell Rensburg agrees that South Africa needs to align with international tobacco control frameworks, and that our taxes need to be increased by 15% to get to the World Health Organization tobacco tax threshold. Allow me a quick thought. Would more taxes on tobacco products not cause a boost in the illicit tobacco trade? We know how big the illicit tobacco trade in South Africa is already, so more tax will just boost it. Russell Rensburg says that alcohol sales make up as much as 12% of GDP. Or if you want to put that into money terms, then it would be around 600 billion rand. It seems we South Africans are a thirsty bunch, because that would mean every South African of legal drinking age is spending over 15,000 rand per year on alcohol. But as statistics work, there are people who spend way more than others. But even so, these are some pretty wild stats. Rensburg admits that a reduction in demand in these industries may lead to job losses, that being the tobacco, alcohol, and sugar beverages industries, but feels that the losses will be negligible and that the benefits to the health system outweighs these job losses. He believes that most parts of these industries are mechanized anyway, so job losses should not be significant. I would like to see him tell that to the face of a worker who has to tell his family that as sole breadwinner, he has now lost his job in the name of good health. Rensburg also believes that healthier populations are more productive, and with reduced health costs, other opportunities will arise for jobs. Critics of the proposed additional taxes are wary about how effectively the funds will be managed, with corruption and all. Can the government be trusted to allocate these funds generated by additional taxes appropriately without mismanagement or corruption? As the government seeks to address rising healthcare costs through taxes on sugary beverages and other products, many farmers, particularly those in the sugarcane industry, have raised alarms about the negative impact on their livelihoods. The Farmers Development Association, FDA, argues that while the intention behind these taxes may be to promote healthier lifestyles, they have inadvertently led to economic hardship for local producers. Factories that once thrived in rural areas are now closing down, resulting in job losses and diminished income for families who depend on sugarcane farming.
We are sitting with ghost towns. 2 sugar mills factories have been shut down. One in Mzimkhulu, one in Dana. They've been shut down, thus leaving those little towns as ghost towns.
Families are also feeling the financial squeeze as prices for sugar and related products soar due to these taxes, which the HTA feels is not high enough. Parents who already worry about how to provide basic necessities for their children will not even be able to afford even small treats, as the sugar tax makes these treats unaffordable. The sugar tax, intended as a public health measure, has instead already created a burden on those who can least afford it. In light of these challenges, the FDA is calling on the government to reconsider the sugar tax. In other words, scrap the sugar tax in its entirety. They argue that rather than curbing unhealthy consumption, it disproportionately affects local producers and consumers alike. This plea resonates deeply within the communities that have long depended on sugarcane farming for their livelihoods. Sugarcane farmers feel betrayed by policies that overlook their contributions to the economy while focusing solely on public health metrics. Critics suggest that a more balanced approach is necessary, one that considers both public health objectives and economic sustainability. For instance, instead of punitive taxes, the government could invest in educational campaigns about healthy eating, or subsidize healthier food options to promote better choices without harming local economies. Walk into any store and notice how much more expensive healthy options are versus other foods. Is there solid evidence that higher taxes will actually lead to a substantial decrease in the consumption of tobacco, alcohol, or sugar products? While there are some studies that suggest that increased prices with added taxes can deter usage, others point out that individuals often find ways to circumvent such measures, whether through black markets or simply by prioritizing their spending on these substances, despite the higher costs. In other words, you're opening a completely new can of worms, where an illicit industry trading in alcohol and sugar is created, similar to that which we already see existing in the tobacco industry. So what are your thoughts on this? Put them down in the comments and let's discuss. Thank you for watching, and if you did find any value in this video, please do like, share and subscribe, as this helps me make more videos. I'll catch you in the next one.